is very low, and adherence as well. So, recently I've actually seen two where we've get this sort of, it's a strange term called puckering or adhesion of the skin to the paratenon. And they can be, in the last two that I've seen, have been quite painful. And now these aren't 40 years patients. These are patients that have come in from, different places, and they get this adherence. And it can be painful if you imagine someone pulling on parts of your Achilles tendon on every step. That can be really, really uncomfortable. And so those then go for a surgical debridement. And they're the risks with surgery, is that you get these risk of infection, obviously risk of failure, but also some of the puckering and some of the other maybe potential keloid scarring in our Afro-Caribbean populations that rupture their Achilles. So.
And also, you were mentioning earlier when we were chatting before the podcast that from a physio point of view, you like the reassurance that you've got those two ends together and you do get more strength in that repair because of the way they repair it relative to conservative. So talk me through that.
I'll go back to a conversation you and I had, which was, I'm always worried that they're going to come apart. So I ultrasound them to make sure.
Yeah.
So with the surgical repair, assuming the surgery is done very well, and let's assume that it is, I'm not so worried about the fact that at 8 weeks when I get them walking that they're going to lengthen or that they're going to come apart, and I don't need to ultrasound them. I actually do ultrasound them at 12 weeks to make sure that they've got a good 1 square centimeter of thickness to the tendon, because the outcomes are much better at 1 year. But I don't worry about those sorts of things when they've had a surgical repair. That being said, some people are not appropriate for a surgical repair. And I think, I've got a couple of people that are actually really quite athletic that have had a conservative repair and actually done really, really well. So I think, with outcomes with all surgeries, things like your body mass, your fitness, whether you drink, smoke, your diet, all those things are really important. And it doesn't matter if it's an Achilles repair or an ACL. Those things do have a role in your outcomes longer term, whether you get better or not.
Do you think from your experience that people that have a surgical repair get back to sport quicker?
I think they do, because I can get them doing the things that resemble them returning to sport a little bit quicker.